Oh, now we're recording.
Okay, I'm gonna let the folk in. And Councilmember Cummings is on. Good afternoon, everyone. We will hold on just a few seconds and make sure we got everybody in who wants to attend, and then we will get started. So good afternoon. We are at 3:02, and we will go ahead and call this feedback session to order. Good afternoon, everyone. I am Sika Rose Green, Executive Director, Children's Services Council of Leon County, and we are here to have a feedback session on family resource centers. So by way of reminder, we will be reprocuring an invitation to negotiate for family resource centers to be established here in Leon County. And at the direction of the council, and quite frankly, we think it's a great idea as well. We wanted to offer some feedback sessions as well as an informative session so that our community is better acquainted with what family resource centers are, the national standards, maybe some information you would like to share with us, so that when we issue the procurement on August 1st, we are really in a posture to get proposals that will address the need that we are trying to meet. Before we get started, I would like to acknowledge that we have one of our council members on the line, Councilmember Carolyn Cummings. And Councilmember Cummings, you do not have to turn your camera on, but I did want to acknowledge that you are with us. And then next, before I turn it over to Holly McPhail, who is our Special Projects Manager and also our Procurement Manager in that role, please feel free to put any questions you might have in the chat. We will get to those toward the end. And then there will be periodic times during the presentation where we pause and ask for your input as well. This is not a time to be shy, but rather a time for you to ask whatever questions you have and offer whatever input you want to offer so that we can make this the best procurement and get the services that we know our children, families, and youth in Leon County need. And so with that, I am going to turn it over to Holly McPhail.
Thank you, everyone. It's very nice to be with you today. I do apologize that I'm not on camera. I found myself stuck in a tailback or a traffic jam. And so instead of not joining you, I just picked up the phone to join you via this way so that we can be sure to share the information that we have and to record your feedback. If you'll go to the next slide, thank you. The purpose of today and what we're hoping to accomplish during this next hour with you is to just provide you a little bit of an overview of what family resource centers are and what they could in fact be. For those of you who were able to join us this past Friday, Ms. Green just alluded to the informational session that we hosted, where we actually brought in 3 different family resource centers that are currently operating using nationally recognized standards from the Casey Family Program and some of the other national partners. And in those kind of conversations, they really dove into very specific lessons that they have learned during the implementation process, as well as highlighted what FRCs can accomplish and how unique that they all are depending upon the setting that they find themselves in. So we'll just provide a little bit of an overview of again, what FRCs are and some of those lessons that were learned, and then we'll really open it up for discussion. Again, I want to reiterate what Ms. Green said in terms of this isn't just a session for you to learn about FRCs. We really do invite your feedback and have very specific question prompts. And then we'll spend some time at the very end if there's other things that you would like to contribute to the conversation. So with that, if you'll go to the next slide. So overview of why family resource centers, like why are we as the Children's Services Council even looking at them? So I want to start with back last summer, the CSC completed its first needs assessment, and that identified the true need for improved access to services, despite there being more than 1,000 providers that are registered here in Leon County alone that provide services to children, youth, and families. But what we have come to determine through our needs assessment is that there is not a lack of services available in our community, but rather extreme barriers to access. Not only is this related to transportation, but it's also related to significant inequities in terms of how do you access them? Are they affordable? It's not a question of availability, but it's a question of access. So based on that needs assessment, we then devised kind of some strategies from the research firm that we brought in to help us with that, of what we could explore, and really fell upon this idea of family resource centers as these neighborhood-based physical buildings that almost serve as a one-stop shop to come into the neighborhoods to provide very specific resources directly to families. And we wanted to make sure that we were on the right track. So this past spring, we actually held listening sessions that confirmed that the #1 requested kind of family support service was in fact this idea of trusted navigators. It's one thing to know that there's all these services out there and the ability to pick up a phone and dial 211 and get a referral somewhere. It's another thing to know that you can call 211. That was something that was a little bit of an eye opener for us during the needs assessment, is that most families didn't even realize that that was an option available to them. But two, when you have all this information just handed to you, you're not quite sure which way to go or how to follow up or who to call when you just get that, oh, here's some information. There's that the concept of trusted navigators, or going into a place and seeing someone who looks like you, speaks your language, and can in fact kind of walk you through or give that warm handoff instead of a cold referral, was really something that emerged during our listening sessions early this year. So the other thing that was very apparent in the needs assessment and then confirmed again during the listening sessions was that the most highly requested services beyond the trusted navigators was an idea of kind of basic needs: housing, healthcare, food, cash assistance. When we asked the community, what does family support mean to you, the things that they were asking are not the prevention mindset where we eventually want to leave the CSC, but really what are the immediate things that I need now today. And that's another reason why family resource centers popped up as a potential solution to that, because that's exactly what many of them are equipped to do, while folding in the concrete supports and the social connections that families need to be kind of on this preventative continuum for our families. So this past spring, I believe it was March 31st, we adopted a plan to build these neighborhood-based staffed resource hubs in direct response to that needs assessment and those listening sessions. Next slide. So specifically, family resource centers, also referred to as family centers, family support centers, parent-child resource centers, parent education centers. These are community-based resource hubs where families can access formal and informal support to promote their health and well-being. Now, FRCs can be pretty much located anywhere, which is something that we learned during Friday's informational session. They can be a single room in a library. They can be an add-on to a child care facility. They could be based in schools. They can be standalone centers that we've also seen. And we understand now that all of these different types of models work, but what unites all of them, that there is a physical location that families are able to come into and know with confidence that they will be able to access resources. The other thing that is very interesting about family resource centers, and a lot of people might say, oh, we have these centers that give out resources and do that. What sets an FRC apart from, say, a general community center, or maybe, you know, a community center that's attached to a library, like we have here in Leon County, is that they are uniquely community focused and driven by family needs. So yes, a lot of them offer a multitude of programs and resources, but really what sets them apart is how they follow these national standards that puts the family at the center of the service design and the service delivery. So what that looks like, as we learned in the examples that were shared with us, is a family member will come into a resource center and they will kind of dictate the services that they need. When a center is following these national standards, they're also, they typically have some sort of parent or family advisory committee unique to that center, which more often than not is unique to that neighborhood. So what might be offered to bring it home local in, say, the Fort Braden area versus maybe the Pineview area, while both of those might be located in 32310, the neighborhood needs in those two different communities are going to look very, very different. And that is what really truly sets FRCs apart. So you'll see on the slide, if it's, I don't know if they're all popping up for you or not, but you should see on the slide the different the national standards: family centeredness, family strengthening, diversity, equity, and inclusion, and I think there's two more that should pop up around community strengthening and timely data and evaluation. So those standards have really truly been developed with Casey Family Programs and several others on how you can create a family resource center that research has shown will advance family and child well-being. Oftentimes, it is centered around this concept of protective factors. There are 5 protective factors that are really related to this space, and that would be parental resilience. So how flexible families are in times of struggle, how are they able to bounce back? Social connections, which is a big difference between a lot of the family support home visitation models that are out there versus having kind of this center-based or place-based resource center. We have concrete supports in times of need. And again, that was really heard loud and clear from our listening sessions of resource hubs that can provide that, as well as knowledge of parenting and child development. So this is really kind of that parent education component that you're going to hear a lot about and really see as the core difference between the FRC models that we're wanting to build versus just existing community resource centers that are already out there, plus the social and emotional competence of children. We understand that the mental health needs of very young children to our teenagers is paramount, and giving resources and access to resources and information, and again, like even social connections for our young people is crucial to an FRC model. The other piece that's a little bit unique about the Family Resource Center model is that, yes, they're focused and they're driven on the concept of strengthening the family and promoting diversity and putting the family's needs central to their service provision, but that tangentially they understand that by doing this in a parent and family caregiver leadership fashion, you're also strengthening the community to take care of itself. And that's the other beautiful thing about this model. And of course, none of it could happen without this clear focus on data collection and evaluation to know that the work that is happening and that the efforts that are happening are in fact leading to change and differences. And one of the mantras underneath that evaluation standard is a commitment to continuous quality improvement. How are you constantly assessing your service provision to be stronger, to be more reflective of the needs of families and all of that? So again, that's the kind of overview of what a family resource center is and kind of a little bit what it isn't. Currently in Leon County, we do not have any family resource centers that are following these standards. There's lots of resource centers that are out there that do different things, but are none that are nationally recognized by KC Family Programs, which is one of the reasons why we wanted to invest in it. Next slide. So what better way than to, we're immersed in the research and we kind of put it out and knew what we wanted to build, but to help our community truly understand what FRCs are. Last Friday, we invited 3 different FRCs to join us, and that was Partnership for Strong Families, serving Alachua and kind of surrounding counties right here in Florida. The second one was from Connecticut, the state of Connecticut. They actually have a statewide system in partnership with their school districts, so that they have school-based family resource centers throughout their community, throughout their state. And we had East Haven join us to kind of talk a little bit about how their resource center is very focused kind of on that early childhood continuum, which we also heard was a priority for our community. And actually, as she was speaking, reminded us a little bit of the community partnership school model that we have deployed over in Sable Palm. The third one was an example from Sur Familia, which is based in the Atlanta, Georgia area. They have 5 different centers there, and they've actually just opened a new one in Puerto Rico. And their big focus was, how do we create a family resource center specifically to serve their growing Spanish-speaking population? So that was a big focus for them. And you can imagine how large Atlanta is. So having 5 family resource centers in Atlanta, they say that they need even more. But we wanted to kind of show, and all of theirs are brick and mortar standalones. That was really just, it was very kind of eye-opening. So one of those lessons, as you see here on the slide, is that physical location can vary so long as you know who you're trying to reach and that location works for them. So again, I made the comment about the needs of the Fort Braden community versus the needs of the Pineview neighborhood. They may look very, very different. And we know in Tallahassee and Leon County that transportation is a true struggle. So that the difference between the transportation needs of, directly south side versus south and west side looks very different. Similarly, as we learned from the Alachua folks, that the services that you might offer at a location will look very different depending upon where you are. So the Alachua folks are actually, it's kind of the larger area. They, the services that they offer at one of their northern locations, which is a brick and mortar standalone, is designed specifically to do a lot more transportation and home visitation services, because they were only able to find one brick and mortar site to serve 3 counties, Columbia, Union, and Bradford. So as you can imagine, transportation is definitely a thing that they have. So how they schedule their services, what they offer on the different days, varies based on what the needs of their population are. Where some of their more central, or we'll say like the downtown or the more central to Gainesville, they have 3 different FRCs in Alachua County by itself. Some of them are just connected to the library. So that they can have, like, right there, it's easy access on a bus line and they're able to kind of come in. Whereas what we heard from Connecticut is they really focus on making sure that childcare availability is there, screening tools for young children, really a lot of those parent education support groups, drop-in groups, all of that. And it's really important to them that they maintained access to their family resource center during the summer when the schools were closed. So you can kind of see that, like, depending upon what the model is, what should dictate what type of services that you provide. And our example from Atlanta, because it was primarily designed to serve all of the needs of a family where English is the second language, they started receiving tons and tons of referrals from every service provider, so that they were able to help these Spanish-speaking families navigate the system of care. So they were bringing in a lot more services than any of the other 2 programs that we learned from. Which brings us to this third point that was kind of a drop the mic moment on our Friday session of customer service, of how important this mindset of putting the family at the center of service delivery, how important that is. And I even believe one of the lessons learned was, how do you say no to other service providers? Because what's central to all of these family resource centers is that a single entity is not doing this alone. What makes an FRC successful is the collaboration of service providers coming together and not reinventing the wheel. If there is an existing program that does something well, the idea with the Family Resource Center is that you engage that provider and you bring them in as a partner to use the facility and provide those services, as opposed to you trying to figure out how to be all things for all people. That was a huge lesson. And as FRCs start growing in popularity and of course growing in success, especially when they're using those national standards, more and more providers want to be part of it. And this was a lesson that they learned, is if those partners don't have that same mindset of customer service and that the family drives services, then they might not be the best partner for you to bring in, and you might have to tell them no, because what you don't want to do is disenfranchise the patrons that are coming into the Family Resource Center because a service provider wasn't clearly vetted or didn't have access, as much access, or kind of that mindset of putting the family at the middle. So that was just lots of lessons learned. And of course, the final bullet you see here, which I think we harped on a little bit with the standards, is data collection and evaluation are necessary. I think with everything to have funding continue to support this type of investment, then you need to have data collection, you need to have policies and procedures, you need to have instrumentation, assessment tools, and the wherewithal of how to use those tools so that you can ensure that everything is moving forward and that you're having a positive impact. Now, the beauty of being a nationally recognized FRC is that there are tools available, self-assessment tools, regular evaluation tools, suggestions for service delivery models. And that's, again, one of the reasons why we really wanted to go with this model of the nationally recognized FRC standards. So I know I've talked for about 20 minutes, really, really rapid and throwing a lot of information at you. At any point that you want to go back and watch the whole session, it's just over 2 hours. It is posted on our YouTube channel and our website. But now we want to kind of hear from you. So if you'll go to the next slide for me, where we're really looking for some input and information from our community is thinking through this idea of location. Are the core services that we've preliminarily identified, is that the right services that we want to start with? Are there suggestions on how to ensure that services are family centered? And then we'll close out with just talking a little bit about the funding process, so that if you have any input on how we select the right partner, that would be helpful as well. We'll go to the next slide. So what you'll see here is a map of Leon County. All of those districts are the various different zip codes that are in our community. And you'll see that those with the darker shades of orange are where the highest concentrations of children living in poverty are. Now, we could swap out the data and say, where are our lowest performing schools? We could swap out and put the data for those that are reading on grade level by third grade. And we're going to see this very similar process, or this similar kind of striation of distribution of where our community is. So you've heard people probably talk about the tale of two Tallahassees, where we have kind of our northeast side of town and our southwest side of town. And you can see clearly from this map how that delineates. Now, I will say that this data on this map is ever so slightly dated. So if you try to add the numbers up, it's not going to match what that pretty little box is. But we did pull this information directly from the Florida Chamber Foundation scorecard. And they have made a commitment to keeping these numbers that you see in the little box completely up to date. And for as long as I can remember, from way before I was in college and definitely throughout the history of at least the last 20 years, this level of child poverty has hovered around that 20% mark almost consistently with very little change. So we know that if we want to impact a lot of those outcomes that we talked about, that I've mentioned, is that we have to start with a provision of resources and kind of a concentration in those neighborhoods that need them. So in our procurement, we are suggesting to start with just 2 family resource centers to implement over the next 2 to 3 years. And we are saying that they should be located in one of these 5 darker orange areas, but they are large. So I want to kind of pause here and just ask for some feedback as it relates to where these resource hubs should be located.
So participants,
free.
please feel free to unmute, or if you want to raise your hand, either way, but we'd love to hear from you.
I'm happy to start if you can hear me.
Yes, John, go ahead.
I'm sorry, I'm traveling back from the Florida Coalition for Children conference, and so this was the best time I could join. But I don't have a strong opinion on specific location, but just looking at this map and the data, the keynote that I just listened to a couple hours ago is doing a control randomized trial on decreasing poverty, a nationwide study. And she doesn't actually have any sites in Florida, but she did pull Florida data, and she said that the state average right now is at 17%. So I think that's noteworthy that we are 2 points above the state average, and her data that she showed this morning had the national average even lower, I think at like 12 or 15%. But to specifically answer your question, I always think something that's located conveniently to transportation, as you've mentioned, would be good. So something that is close, since we do have a hub and spoke type public transportation system, something close to the bus station, within walking distance of the main bus station, seems like that would be, I think that's in that one central orange area. Is that correct? I'm not 100% sure how that maps onto the roads. And something else that comes to mind is, depending on the population distribution, would be maybe something out by Fort Braden, since there's already a school and a library there, and that looks like that is a poor area of the county. Those are kind of the 2 that come to mind the most, besides having something maybe located in South City.
Thank you, John. We really appreciate that feedback. Others?
Holly, good afternoon, everybody, Madam Executive Director, and all you guys. Thank you so much so far. I've enjoyed the presentation, but looking at the map, am I looking at it correct that the 32304 area is the darkest on the map, and which would indicate is where the most need is concentrated as far as our children and families are concerned?
Yes, so you are looking at that correctly. So that 32304 is that darkest area right in the center. And then, of course, 32310 is a very vast, it's one of the larger zip codes. But you're correct, Commissioner Cummings.
Okay, and so to extend it a little further, then, if those are the areas of most need, then would we be requesting that the resource centers, if we have 1 or 2, be located in those areas, or just be accessible as far as, I guess, the entity providing transportation, or there be public transportation, so that the children and the families would have access to the resource center.
So good point. So this also came up in our last feedback session. And so I think it's important for the community to know that when we are, as a council, are saying 2 resource centers, it's not 2 and done, but that would kind of be our start, because ideally, because the resource center is supposed to address what is going on in that zip code, in that neighborhood, you would really want to have as many as a particular zip code or census tract could support. So, and I believe you were on the informational session when we had the other communities that had resource centers.
Right.
You know, some are up to 52, 51. Gainesville has, I think, 6 or 7 and are looking to do another one. So we would be looking at those first FRCs to be a starting point. And whoever the provider is, we would work with them to determine where the first one would go, where the second one would go. And we expect that the outcomes are going to be right in line with other resource centers that we've seen in the state, as well as in other parts of the country, that we could easily be looking at expanding them, so that I'm probably speaking way in the future, but you literally in 32310 could probably support about 10 in that
Right.
one zip code, given the
Right.
neighborhoods. So in 32304, you could probably support 2, maybe even 3,
Right.
maybe 4, if they're, you know, really, yeah. So does that kind of address that?
Yeah, it does. It does. So my follow-up question then is, once we revise the invitation to negotiate,
Mhm.
are we providing the map? Are we providing the statistics so that any interested entity will know, number one, you know, what the priorities of the council are, number one, and what areas that we really want to see we can make, if we can make a difference in it. And as a result, I guess, of the study that we pay for to sort of pinpoint where the specific needs are and what our priorities are.
Absolutely. And so the thought would be, you would start in your area of highest need. You would start with a center that is in your neighborhood, if you will, of highest need, the census tract of highest need within that zip code. Starting there, building on that, and then moving to the next one. So it's not that, of course, we know there are lots of areas that need the assistance, but we want to go to the area that would probably have that highest need first, because that's going to be your incubator or your test, if you will, on how you move in other areas of the county.
Right,
And
right.
yes, they
I
will be
appreciate
provided
that.
that information.
But
Mhm.
I just want to know specifically, when we do the invitation to negotiate, will the entities, whether they're local or out of town or not, will they know, they will be provided the information that we have based on the study to know that the 32304 is one of our prime areas of concern?
Absolutely.
Okay, and then they will know the other shadowy areas where it's also concerned, 32310, 32305, that type thing.
Yes, ma'am. Mhm.
Okay, all right, thank you.
If I
Thank
could
you,
add,
Commissioner
thank
Cummings.
you, Commissioner Cummings. If I could add to that, some of the kind of, I don't want to say that, yes, the concentration of highest child poverty is in 32304. The difference between that and 11 and 05 is small, because they're, like, you can see that they're all kind of that darker orange. So it won't just be the child poverty indicator. It will also be some of the other indicators. Actually, in our needs assessment, we were talking about this as a team earlier today, of possibly including the breakdown by zip code directly from our needs assessment, so that they can see those kind of school districts and neighborhood-based concerns. And then in yesterday's feedback session, they actually said, is there any possible way that we could show this map not by zip code, but rather by census tract? And that if we're able to code that data that way, then that will help get to this concept of neighborhood-based, because as you can see, the space of 32310 and 32305 are much larger geographic spaces. And if we break it down by census tract, is it clearer where those pockets of greatest need are? I'll also take a page from the United Way in speaking about ALICE. And ALICE is because oftentimes our greatest concentrations of poverty is also where a lot of existing dollars and infrastructure already go. And oftentimes those that are kind of in the ALICE population get missed out. So those are some additional pieces of information that we can provide in the kind of the background to our procurement of where do we want to site these. But ultimately, and I'm really glad that you brought up the process of the ITN, ultimately we're looking at a partner who may already have connections in those areas, or that there's space available, or that it's adjacent to additional services, as Mr. Sheets suggested, of being close by a transportation hub, or maybe there's an existing resource center that only operates 9 to 5, and that the FRC is going to suggest operating in non-traditional hours, or maybe even offering some non-traditional childcare. So we can get creative with the location, so long as it's based in these areas of need, and then there's that buy-in and that kind of mentality of the services that we're going to provide. Which, if I may, if Jacinta goes to the next slide, you'll kind of see the service differences. So again, the difference between a traditional kind of community resource center that maybe is like already at our libraries versus a family resource center is the focus on this kind of parent education and how do we build protective factors. So we've kind of talked a little bit about location, but it's really about the types of services that we want to provide. And so on the screen now, you'll see the 6 that we had listed in our original procurement as the core services. Again, resource centers provide services beyond this, but these are the services that are associated with increasing family resiliency, family self-sufficiency, and increasing their protective factors that is associated with that decrease in the risk of child maltreatment. So this is how do we get these services on the prevention continuum. So just want to ask you to take a look at this list and kind of reflect back on it of maybe what's missing from this list of core services beyond, again, the ancillary things that kind of might already exist, like job training, right? We're not trying to recreate the wheel, but what is missing from our current continuum. And I will share, because yesterday.
Go ahead, Holly, because I want to acknowledge that John had his hand up, and I don't know if it was about the previous location issue. So I just want to make sure we don't forget to let him speak. Finish what you were saying, though.
Sure. I was just going to share that since this is our second feedback session, I just wanted to share that yesterday we had a discussion on where it says child development activities to maybe add a 7th bullet for youth development activities, that really a family resource center could look at the cradle to career or cradle to college type of the whole continuum, and not be so focused on the front part of that continuum. And that was just feedback from yesterday. So I will pause and allow Mr. Sheets, or I can't see any hands, so you'll have to manage that for me. Thanks.
Yes. John, you had your hand up.
I did. Thank you. As you and the commissioner were speaking, I thought of a couple other suggestions. I'm sorry to dominate, but you asked them, let's throw them out there. Something located on the South Monroe side would be close to South City. It's on a bus line, and it'd be close to the Bond Clinic, which is doing, I think, a number of these services we would want to connect with. They bring in farm share, they have medical services. Play Big, I think, is opening a facility near there, so that could be a logical place. And the other place that I thought of was somewhere near the Leon Human Services Center. Not the easiest place to get to, but with child welfare, a lot of parents are going in and out of there. That's where the visitation center is. That's where there's a child care facility that could, perhaps if they could be encouraged to operate both the visitation and the child care center to be operated slightly extended hours, I think that could offer a lot of support to parents and maybe be a logical place to tie in a resource center. To this list, though, I think this looks like a great list. I think I see how these based in the community could be really important. And I would be curious, based on your listening sessions that you did last year, where you got the best participation, because that might be a good place to look at basing one of these first pilot sites.
So Holly, before you chime in, I also want to acknowledge that Ms. Bernice put in non-traditional hours for the resource center itself to accommodate parents who have non-traditional working schedules. So if they work until 5 or 6, keeping the resource center open to maybe 8:30 or 9, so that they have the ability to participate and get access to assistance. And I think what Holly was going to say is, so when we did the listening sessions, I think it's no surprise that probably the 2 areas where we had the most participation would be in that South City area, so the South Side, and then also I was going to say that Griffin Heights area, so over in that area, the Riley School District, and in there. Did I remember that correctly?
You sure did.
Okay.
But to be
That's what I
fair,
thought.
and not trying to say that like the other areas were small, but those are also the population, like there's more population in those areas as well. So I'm like getting out to Lake Jackson area or Woodville, or some of the South Side. I think we had one at Sable Palm even. They didn't have as much participation, but those population centers are also smaller. So I think that I think we had great participation at all of them. I think that the conversation, more importantly, was very, very meaningful. It was very interesting to see the differences depending upon where we held the listening sessions, and even during the focus groups for the needs assessment, it was very similar in terms of participation. That centrally located, that Riley neighborhood, we had so many youth come out to that one that we held a second session and actually had to go back out for more pizza because we ran through everything that we had, which was such a great problem to have, right? And the kids were super engaged, and we had young people as young as 7 all the way up to 17 that were participating and like calling their friends or texting their friends and saying, you need to come over here. They're listening to us. So that was very, very impactful.
All right.
And I just want to give a shout out to Bernice because we heard that about the non-traditional hours. So thank you for saying that, because that's something that I think we can absolutely strengthen in our procurement in our state, like what we hope to achieve.
If I could add one more thing that maybe isn't on this list, or maybe it's kind of there between the lines, is helping access online resources. So I don't know if that looks like helping someone navigate it on their phone or having a computer, but there are more and more resources that are state-based or tele-based that I think parents might not know about. But although we want things, I understand, tailored to the neighborhood, maybe there are legal services or family court services or things that are more based on state law and they could access through other avenues.
Great feedback. That's a fantastic idea. Other suggested services, again, core services. The idea is to develop these one-stop shops for families that you feel strongly, or that you would like to contribute and suggest for this list. Okay, Jacinta, I'll ask you to go to the next slide.
I'm sorry, Holly, I didn't understand your question. What was the question?
Oh, are there any additional services that are considered core services for a family resource center that you feel should be on that list? So we've added youth development, we've added some of mobile resources or tele-resources, like the provision of that, non-traditional, not only non-traditional childcare, but non-traditional service access.
I know the libraries have computer centers where the adults can use a computer. You know, it's so many things that we use the computer for now. So I think from a holistic approach, perhaps maybe a computer center that's equipped with at least, 3 or 4 laptops or something that would give the parents and the children, to be honest with you, access. And that might.
Great suggestion.
Okay.
No, and to your
I'm sorry,
point,
I need to cut you off.
No, that's
Sorry.
okay. I'm fine.
and to your point, Commissioner Cummings, we already, very soon after we moved in this office, we already had conversations with 211 about kiosks that they have available to put in not only our office, but various family resource centers.
Oh,
Career
awesome.
Source has kiosks. So it's really a matter of getting the locations
Right.
so that we can use all of those resources. And I think Holly said it, it's not just about recreating the wheel, but we've got
Right.
lots of resources. We just got to, get them all
Pull it together.
Mhm.
Absolutely.
Yeah.
Awesome.
I think that this is a great time to just like tease out the partnership with 211, because in addition to just like the kiosk, this idea of kind of like an integrated system of care so that a family, and this is a great segue to family-centered services, that a family that comes into a resource center to access services doesn't have to complete the same paperwork 19 different times to the different service providers that they have. That was something that the Atlanta-based FRC shared, is that because they have that trusted navigator or case manager, I'm using these terms interchangeably, but I know that they mean different things to different people. We would have to clearly define what that means. But this idea that could we truly have an integrated system where our providers are talking to one another instead of all serving like the same family and maybe even duplicating services for that family. FRCs play a huge role in helping to eliminate some of those redundancies and increase efficiencies. And I would venture even to say to reduce frustrations with our families, because they don't have to fill the same thing, fill out like the same forms over and over and over again. So really proud to say that 211 is working with a lot of different community partners on how to achieve that, and really see the family resource centers as an opportunity to kind of showcase that work as we develop. But as Sika always says, we have to learn to walk before we run, and so we're working towards that. But that would really truly reflect this idea of family-centered services. One of the things that we're really interested in feedback from is, in our previous procurement, we talked about what does it mean to be a member of a family resource center versus a drop-in. And that's the language that we used, but we wanted to spend just a couple of minutes of talking about what that means. Over in Alachua and Family Partnership for Strong Families, they use the word patrons for people who are, quote, members, if you will, of a family resource center. That does not mean that they pay a membership fee. What it means is just that they come in and that they're not just dropping in for services, they're actually coming in and receiving services provided by the FRC itself. And just wanted to kind of talk a little bit about terminology and language, because one of the big things that we learned from the other FRCs is that trust is paramount, and we don't want to inadvertently scare families away if terminology is not appropriate. So, question of this member versus drop-in, does anyone have any thoughts or feelings about that?
I just want to.
I'm sorry. Go ahead, John.
Oh, I just wanted to say that I think this is a really important conversation, and maybe it might vary from community to community, like from family centered, but I think the less we can make families feel like they need to belong, or there is any type of tracking of them, or there is any, strings attached. I think that's really important, because I think that it's a big impediment today to people trusting organizations.
Yeah, and along that line, I guess my question was going to be, well, would they have to fill out an application or something, or put their name in the computer? If that's something they would have to do, people tend to be kind of reluctant to do that. So my question, Holly, was how do we envision getting them to be a member of a resource network or family resource group?
So
It's a great question. Oh, go ahead.
no, it is a great question. And I think that it's a bit of a hybrid. So I think that when you're talking about some services, this is why it's important for those FRCs to be staffed by people from that neighborhood, for them to be a part of the FRC's development, and for those neighbors to be on the advisory councils for each FRC, because those are the people that are seen as trusted in the neighborhood. And so while we don't want to put the Apple tag on them and track them, in order for us to be able to evaluate effectiveness and outcomes, there will be some sort of information that will need to be gathered. And so let me give you an example. In Hillsborough, they do call their patrons members, and they become members of that FRC, and they check in just as if they were checking into a health club, or a gym. And the people that work there, many of them used to be members themselves, or are members themselves. And so if we are able to do this the way that we envision, and that we know the national standards say we should, because they are a trusted part of that neighborhood, the trepidation of those wanting to use those services gets lower and lower, because customer service is first. The other thing is, no one's turned away. If you need the help, they're going to get you the help. It's not going to be, well, you fill this out or we can't help you. That isn't putting your customer and your client first. The last thing I'll say is, it actually just hit me, and I've sat through how many of these, and it literally just hit me. It may be that each center, once they determine what the name of that center is, maybe they create whatever those patrons are. So very similar to, I'm a graduate of FAMU, so I'm a Rattler. Those who go to Sable Palm are Sable Palm, what are they? They're the patrons, yes. So they're the patrons, or the Rickards Raiders. So maybe that would be a wonderful way for the community to decide what are those people called when they become a part of that center. Does that
I love that, and I think that it's perfect a reflection of what that role of the parent advisory committee is, or whatever they want to call themselves, because I think that is I don't want to say a misnomer, but this idea that, oh, we're looking for one partner and they might have a single parent leader on their board. I'm like, no, we're not looking for that tokenness. Or they might have this whole advisory committee with all these influential people on it. It's like, no. We want it to be of the parents, by the parents in that neighborhood. And I should say parents and caregivers. We want to be inclusive of all caregivers. But having them lead is a huge part of developing that parent advisory council. And FRC, the National Friends Resource Center Network, has these self-assessment tools. And one of the suggestions is that even part of the application process, that you conduct a parent and family leadership self-assessment. You're going to determine where you as an organization are at. Not that, like, maybe you're very strong, but not that you can't, there's always room for improvement, and we would expect you to grow with it. But that's one of those suggestions. And some of these things that you guys are talking about right now are embedded into that self-assessment process, which also doubles as kind of like an action plan for any entity.
All righty.
I just have one
So-
brief follow-up question. I'm sorry. I'm trying not to talk too much. The neighborhood resource centers, will they be restricted to a geographic area, or will anybody within, within the county be able to go to any of those centers and receive service?
Well, ideally,
That's a real,
go ahead, Holly. Well, I was gonna say, ideally, it's to speak to that neighborhood. That being said, though, anybody who walks through those doors will get service.
Okay,
So it
awesome.
could mean giving them or helping them with that emergent issue. And
Mhm.
then not even a warm handoff, I'm gonna say a hot handoff. If it turns out they're at a center, but they actually live closer to another center, there's a hot handoff to
Okay.
someone at that center. That, because now I've built that rapport up, and so now I'm over here, well, this one's actually closer to me.
Okay, great. Thank you. In other words, no
the only
type
thing-
restriction, but we'll be working together, cooperating with other centers if there's more than one. Absolutely. Okay.
right. Yeah, yesterday, Sika shared this really great example of the library system here in Leon County, of how where the first library, I think it was actually before my time over at Northwood Mall, but how like they had to start with this one area, and then it grew, and then it grew, and then it grew, and now what are there, like 6 of our kind of the branches, and they all have different hours, and they meet the needs, which we absolutely love. And I think that we just have to remind ourselves that to start off, it may only be 1 or 2 or 2 or 3, but that maybe the big dream is that wide diversity
Message.
and
Sorry.
spread. But the thing that,
It's
and
Lorraine
to
Osley
directly
and
respond to the
Swedish.
question. Sorry, is there a question?
No, but I'm gonna let you finish that, but I have a 4 o'clock that is actually here. So I am going to turn the co-host back over to Jacinta to help moderate. And then Dina is on as well to help with any questions. I do want to thank all of you for being on here, because this is doing a world of good as we go to this next procurement. Commissioner Cummings, listen, I'm gonna put you on the spot that at our council meeting, you can share the information that you gleaned from these sessions, because we really appreciate you being on. And
Okay.
with that, I'm gonna take my exit so that I can meet my 4 o'clock that is here. Thank you guys so much.
Thank you, Sika. We'll wind it up. We really only have like one kind of last question that we want to ask you guys. If anybody does need to roll off because they have a 4 o'clock, we truly appreciate you being here and respect that. We are recording this session. It will be posted later. So anything that you might miss in this last little bit, feel free to jump in. I'll respond. The last piece I just wanted to say directly to Commissioner Cummings was to be on the parent advisory committee, you would need to be from that neighborhood. But very similar to what we learned from Sir Familia is that while their target audience was Spanish speakers, and that's who they primarily serve, anybody could come in and they would help them. So ideally, we would adopt that same mentality.
Awesome. Thank you. And Holly, I've got to leave too. I've got a 4 o'clock here at my office. So thank you guys. I really enjoyed it. Very informative.
Thank you.
Mhm.
Sika, or Jacinta, if you'll go to the next slide for this kind of like last piece. And it's just to very, very quickly go over, we will be seeking a single provider that is a collaborative across multiple locations. We are hoping to start with 2, but if for the budget that we've allocated, you can do more, that's something that we would certainly entertain. There is a 4-step selection process that includes a first review of the written applications against specific criteria that will be published in the procurement, and all members of the public will have access to that. We call that our evaluation phase. Then the top candidates are invited for interviews, which is called the negotiation phase, because what happens in those interviews is that any front runners that emerge are invited to actually submit a revised proposal based on that interaction and the interview. And then the final review of those final offers, and then a recommendation is generally presented to the decision-making body. I want to say this on the record in this recording for anyone who's listening, is that who of the decision makers is always going to be the council members, but the individual for each of those other steps is yet to be determined. So if you advance to the next slide, Jacinta, we will be discussing this at our meeting on Thursday, July 20th at 4 p.m. It will be broadcast to YouTube as well as feel free to come in person if you want to see where the council decides like what role that they'll play beyond just being the final decision makers. It could be that all the members of the council or a combination of council members and members of the public serve in a different capacity for each of those steps. But that has yet to be determined. So if you do have any feedback or suggestions on that, since we are out of time today, we strongly encourage you to come to the meeting in person, or if you can't be there in person but would like something read into the public record, you can submit that directly to our team no later than tomorrow at noon, because we do have kind of the deadlines to be able to submit it into the record. But if you do have comments or suggestions on that, we encourage you to participate in the proceedings. And with that, I will stop talking and take any other questions that folks might have or any comments that you might want to share for the final thoughts. Hearing none, I want to again say thank you to everybody for joining us for the comments, the conversations, everything. And with that, that'll conclude today's session. Unless Dina, you have some final closing remarks to get us on our way.
Thank you all for joining us this afternoon. And the feedback that you has given us has been great, and we will look at utilizing it to be able to establish a wonderful resource for our community here in Leon County. Thank you all so much, and I hope everyone has a wonderful afternoon. Have a great day.